Okay, thank you. So we're leaving only theme 3 before we have a break, roughly at 11:40. So I would really appreciate your active participation as now. Okay, now we move into theme 3, humanitarian crisis response coordination in the Middle East. The session will focus on how coordination between UN agencies, NGOs, and local authorities can improve relief delivery in dynamic and high-risk environments. So we're privileged to hear from highly respected global humanitarian leaders, Mr. Christopher Rassi here, and I think Christopher Rassi is the only panelist for the session. Please welcome.
Thank you. Thank you very much for inviting IFRC and me to speak at this conference. And I'd like to thank for the panelists have already spoken in different sessions. It's been very interesting, and I'll try not to repeat what's been said. And as I'm the only panelist on this for this session, I'll bring one particular contribution, but that's by no means the only contribution that can be that we can have on this topic. And hopefully that'll get you interested and to ask questions and to engage, and others can share their experiences. IFRC, for those that don't know, the International Federation of Red Cross and Red Crescent Societies, is the umbrella organization, the membership organization of 191 Red Cross and Red Crescent national societies around the world, not only in the Middle East, but everywhere, right? In all the countries that you're from. And I think that what we're facing today, not only in the Middle East, but globally, shows that coordination is perhaps more important than ever among actors and all different actors that are working on humanitarian response. And we can't really talk about crisis response and coordination without highlighting, which has been alluded to a bit already, the critical role of local humanitarian actors and local in humanitarian responses. And this, for this reason, I'll highlight the role of one particular local humanitarian actor, which is the ones that I represent when I speak in international forums, and that's our national Red Cross and Red Crescent societies, who are at the forefront of humanitarian responses in many different contexts, some that we've talked about already, but also we could look at the role they've played from Morocco to Palestine to Lebanon to Syria to Yemen to Iran and so it's really everywhere. And they're doing this before, during, and after a crisis erupts, right? They're always there on the ground before, during, and after. They don't leave when other international actors leave. They don't have that luxury, and they don't want to. And we can talk about some specific examples, such as the Palestine Red Crescent Society, and the fact that they can continue to run medical services today with everything that's going on is amazing. And both across Gaza and the West Bank, and they're doing it despite the immense challenges that we're seeing right now in real time in front of us all. Most recently also, in a very difficult context, the Iranian Red Crescent was conducting search and rescue operations in response to the latest escalation hostilities that we've seen. I mentioned Morocco. The Moroccan Red Crescent is still playing a major role in response almost 2 years after a major earthquake in September 2023, which I happened to see. I went to Morocco the day after the earthquake to support with coordination, was able to see, again, in a very different context, but an extremely critical context when we talk about the need to protect, the need to rescue, the need to protect and help civilians recover after a major crisis. Operational reach, scale, and impact can be increased through coordination with local actors, in this case, when I talk about national societies. But despite increased pledges, interest, commitment to support localization, action has lagged. Right? We can talk all we want, but we haven't seen that increased commitment. Progress in funding local actors, and funding, unfortunately, is key when we talk about where we see commitment, has been very slow. And what is it that we're looking to do when we talk about supporting these, local actors that are so critical for coordination? Well, it's capacity strengthening around everything from long-term institutional support decision, everything that supports decision making, everything that supports their ability to act on the ground, and everything that also, when we look at protecting them and protecting their personnel and protecting volunteers and staff who are really the ones that are responding. We must support meaningful representation of local actors in humanitarian coordination and decision-making mechanisms, and that includes all over: global, regional, national, and even and local. But that means real partnerships, mutual respect, transparency, shared responsibility, trust, and accountability. We're seeing that these local actors are often the best place to reach those in need. They have vast networks already in existence. They have, whether it's branches, sub-organizations, people all over. It could be because of their relationships already with authorities throughout. In the case of Red Cross and Crescent national societies, being auxiliaries is really important. It could also be a detriment at times too, as we're seeing as well. But in the case early on, it's extremely important. They have that respect. They have that relationship already in existence. In Egypt, the Egyptian Red Crescent is another example, is able to work and operate in the North Sinai along the border with Gaza. They have that because of who they are, because of their relationships. They have that ability, and they have that ability to support all other actors that are trying to work in this region. And in Lebanon, a context I'm extremely familiar with as well, the Lebanese Red Cross has unique access to conflict-affected areas. This coordination, the mechanisms that they're able to put in place have been done over many, many years. They're able to do, and they're able to ensure, therefore, that their work is done safely, unhindered, and can access everyone in a country when many other actors cannot. But indeed, as I mentioned, being on the front lines and being humanitarian and local actors also leaves them extremely exposed. And when I talk about exposure, I talk about protection and physical exposure. The IFRC network lost 32 staff and volunteers in 2024 alone, in 1 year. And the number, if we go back over the period of 2023 to 2025, we see really the deadliest period that we've had for humanitarian personnel overall, but especially for my network in particular. During this period, the Palestinian Red Crescent Society and Sudanese Red Crescent Society accounted for over 80% of those deaths. But over the last 2 years, we've lost colleagues in the line of duty in Algeria, in the Democratic Republic of Congo, in Ethiopia, in Iran, in Israel, and in Syria as well. We lost so far in 2025, 17 staff and volunteers. But what we're seeing also is a disproportionate attack on local humanitarians. These are actors that are living and dying while working in their own local communities. And when humanitarian workers and volunteers carry out life-saving humanitarian work, they wear emblems, and that's the case for those that I work with and I'm representing here today. We often think that these emblems and logos should act as virtual protection, virtual shields, but because they're the only ones they have. And we've talked about whether, we could talk about what other protection mechanisms should be in place for humanitarians and local humanitarian workers. And I'm the first to say in all innovation, we should not look at innovation right from the forefront, at the beginning and say, it's bad, right? We have to think about ways to evolve, ways to do things differently. But right now, that's all they have. They should send a sign to combatants, don't shoot, we're not part of this fight. Unfortunately, that's less and less the reality today. Humanitarians are there to help and should not have to risk their lives to do so. And that's something that I think we all have to understand. And as I mentioned also, they also cannot leave for medical treatments or R&R. They often lack adequate support systems, including protective gear, insurance, legal and mental health support, and other forms of protection and medical support. And parties to conflicts, states and other stakeholders, including all of us here around the table, must do more to protect civilians and stop attacks on humanitarian personnel. We must speak out consistently. Crisis response and coordination mechanisms that a lot of us that we're here to talk about today must prioritize the protection of local humanitarians. And donors and humanitarian organizations must invest in safety and security of these local humanitarians as well. There are lots of really important initiatives that are being discussed right now. In the lead up to the UN General Assembly in September, we're seeing them, and there may be, and some will be announced. Right? There's one, the Declaration for the Protection of Humanitarian Personnel, of which Australia and a group of ministerial partners is really leading on. Is so critical and very important. And that's a form of public advocacy that we should be, that's key. And that is really a way for us to act, to call to action in addition to what we do on a regular basis, which is grieving. Because every time we have to, we grieve, we support families, we support the families of the lost humanitarian colleagues, right? We help them by providing some fund. We created a Red Family Fund last year to be able to provide support to these families for our colleagues that have lost their lives. It's a nominal amount, right? We raise awareness, but really we need to call for action. We need to ask for that these attacks be stopped. We need to influence others to stop these attacks. We need to protect everyone, as we've talked about, but providing different by critical and specific forms of support and practical support as well. I just want to highlight the importance again of trust and access, right? Because it's earned. It's local humanitarians that earn it over time. And again, we see the example of Lebanon. We saw it over a long period of time during the Lebanese Civil War, where the Lebanese Red Cross earned this respect of populations throughout the country because they adhere to humanitarian principles over a long. They were given that space. They were given that ability to adhere to humanitarian principles. And as a result, still today, they're the only organization who can move the wounded across lines of control. And the consensus in Lebanon is that the Lebanese Red Cross's role as a public ambulance service is still invaluable because over time they had that access, they had that support, including international support, to be able to have that role. I'll just touch on humanitarian access, and reaching the most in need is critical. And we're seeing this, as I said, right before our eyes, and we've talked about it already, particularly in the case of Palestine and Gaza. There are, and we've talked about it already, concerns with the emergence of privatized and security models of aid distribution. We've talked about that already, so I won't go into that. But and humanitarian assistance has to be delivered by skilled, neutral, and trusted organizations. And this is another example. These local organizations have to be the ones, they don't have to do it necessarily alone, right? But they have that skill, they have that access, they have that trust. And the principles of humanity, impartiality, and independence are so critical when it comes to humanitarian assistance. We must continue to defend and protect the space for principled humanitarian work and the role of local humanitarian actors in that space. Just maybe I'll end on the last point that I was asked to talk about again, innovation, technology, and how we leverage technology and innovation to improve lives and to save lives. We're seeing technological advancements, whether they're AI generated or others right now, and we're seeing them change constantly every single day. And they're transforming our world, and the opportunities are so great. And embracing them, particularly in humanitarian operations, is and can save lives, but we're seeing it. However, one lesson we have learned as humanitarians also is the primacy of trust, and particularly at the community level. And the humanitarian sector knows well that technology cannot replace the need for trusted human relationships. So we have to balance that. And this enables access to populations in need. So we can benefit from an advancement, and we should, but we also have to be clear that we also have to mitigate the unintended consequences as well and stay true to what we know works. And that's where innovation is key. So while we look to strengthen crisis response by investing in digital technology and innovation, we also have to place local humanitarians at the center, and we have to do that consistently. We have to ensure that they can work safely, that they have adequate resources, that they have unhindered access, and as we've learned, from my colleague, access means many different things. And we have to ensure that based on this trust and acceptance of affected communities, that we're doing this also in accordance with humanitarian principles. So thank you.
Thank you very much, Mr. Rassi, for your illuminating remarks and for especially touching upon like the values of trust and access to better represent the local actors, and also pointing out the chronic vulnerability in of the local actors that has been undergoing like for a long time period. So we'll now, as he's the only panelist for session 3, we'll open the floor and receive some questions. Oh, Mr. Williams, please have the floor.
Jump in if I may. Thank you, Mr. Rassi. You mentioned the term coordination, and the coordination concern when it came to the so-called movement in the days gone by was between the coordination between the Federation and the International Committee of the Red Cross, especially in armed conflict environments. And there was a whole civilian agreement, and I think mission creep by one or the other of the organizations in certain contexts. And then coordination in terms of the kind of cluster set up, the United Nations cluster approach, and the involvement of national societies, Federation, the IFRC in that kind of coordination setup. With the crisis, let's say the financial crisis that's hitting the humanitarian sector today, do you think there's an opportunity to rethink what coordination looks like between these different agencies, where the mandates sit, and how to bring in certain new efficiencies? And if you were to innovate on anything, what would that kind of new coordination model potentially look like, given the limited resources that we all grapple with? Thank you.
Mr. Rassi, would you like to make some comments?
Well, that's a loaded question, Jamie, but thank you. Jamie's an old and very good friend of mine, so he's allowed to ask me these questions. But yes, I don't have to say it's a difficult period of time for the sector right now. A lot of the changes we've been looking at around coordination, though, didn't start in January. Although there's been this definitely this, I guess, a push to do it and to expedite it. We've been, as a movement, looking at modernizing our coordination mechanisms for the last few years. This whole idea, if you go, one of the reasons Jamie mentioned we have this model in the movement and sort of the Seville agreement that decided who did what in a different type of context, right? Among the ICRC, the IFRC, and our member national societies. We revised that many years later in 2022, because one thing that we realized over the years is that we can have coordination mechanisms for international actors all we want. What's really important is to put the local humanitarian actors, in our case, the national societies, at the center. They're the ones delivering on the ground, always, right? And we're there to ensure that we're providing different forms of support and expertise, and everything from financial to communication support to other forms of support. And that's what our revised Seville agreement in 2022 made very clear. But it's not just the movement that needs to think about that. It's the whole sector. And to all the international actors, because we look to say, what is our role in providing humanitarian response today? And in our case also, supporting a cluster system, again, in particular, IFRC working, supporting the cluster system, doing it especially in one cluster as a co-lead over the last several years. We're also looking to say, how has this international coordination mechanism, how's the cluster system evolved over the years as well? And it's forcing us to rethink it. It's forcing us to regroup. It's forcing us to also show the importance and how do we make sure that local humanitarians and local actors actually have a much stronger seat at the table when it comes to, again, not just to deal, only to have a voice and have an opportunity to speak during a particular conflict or during a particular crises, but how do we ensure that they're speaking and that they're participating in the evolution of the sector? And how do we ensure also that resources, again, most resources that are coming in are are not being spent in a top-heavy coordination mechanism, but that are being used on the ground to support those that are providing the great assistance and making sure that it's being received by the communities as well. So all of this is happening. It's being accelerated now because we all have to see how we ensure that we're being more efficient, more effective, and using resources. Local actors, communities, and donors are all holding us accountable. And so yes, this is happening, and there's a lot we need to be learning from as we're in the process of making these changes now.
Okay, you have a question?
Hello. Thank you so much, sir, for your views and particularly bringing this much needed conversation on how there is a need to protect the humanitarian actors itself. And I see you touched upon the topic of technology. So one way of using technology or AI or innovations is bettering or using them in humanitarian aid. But the other side also, the other party also uses technology in aiding towards genocide or other crimes. So ICRC being one of the organization upholding international law, while its legitimacy or how much confidence the international ecosystem still has in the international law is debatable, but still, do you think what are the measures we can take to ensure that technology is being used wisely or towards upgrading the humanitarian sector itself and not the other way around? Or are there laws or anything that ICRC is doing to ensure that ethics or safeguards are included in it, since digital or technology is a sector which has been booming? Thank you.
I don't think I have a colleague from ICRC who can talk about that in the room today. But I mean, I know there are lots of initiatives that they're working on different methods of warfare and advice they're providing. So I won't answer for them, but I know that there's a lot, and I've seen lots of papers and articles that have been written about that. I suggest maybe you can have a discussion with them about some of those initiatives. But the reality is, yes, I mean, technology can be used and innovations are used for good and for bad. Although I would say, you know, and we have to look at it, and we have to, awareness is extremely important. Education is important. Speaking out about initiatives that are not, that is really important. But as I also said, so I was at a meeting probably last year that was organized by one of the major AI players. And it was in Seattle, Washington, so I can probably tell you who one of those major players was. But again, talking about the unintended consequences and how we mitigate those, right? That's extremely important. We have to be able to bring the examples of where technological innovation is having that harmful effect. We have to have those open discussions, and we have to share ideas about how to improve them, and for the benefit of humanitarian organizations, but most importantly for the people we're trying to serve. So I think that having those open discussions, being at the table, being invited to these forums is extremely important, and I advocate for that at all times. As one of my colleagues said, you talk to everyone, right? That's the only way we could improve. That's the only way we could that we can ensure that progress is benefiting everyone.
Okay, thank you very much for your fruitful and rich discussions. And as I already mentioned, as we're heading to noon, we'll have a 15-minute break. So please be back seated until 11:57. And I wish you all the best in like finding the most coolest place in this building. Okay, we'll be back in 15 minutes. Thank you.